Hi, and welcome back. My name is Robert. I'm a registered nurse, and this is a continuation of today's presentation on how to create a detailed list of your loved one's medications and how to help manage it in a home environment. Certain medications your loved one is taking may require them to check their heart rate and blood pressure first. When you go to your loved one's home and they have a blood pressure machine, you should both establish a place in the home where it will always be kept. A consideration is to place it near an outlet if required to be charged before using, or if it runs on batteries, change the batteries out if it's unknown the last time they were replaced, and keep an extra unopened set of batteries nearby for when it may be needed to be changed out again. If it is to be placed near an outlet, on the wall next to the outlet, I would recommend to place a sheet of paper with your loved one's name and underneath that what their normal vital sign ranges should be as determined by their primary doctor. If your loved one's vital signs are ever found to be out of range, have via their primary doctor set instructions on what measures are to be taken. An additional feature to consider adding to the paper is if your loved one was ever instructed by their primary doctor not to take their blood pressure on a certain arm. Underneath their vital sign ranges, you would write, using the left arm as an example, in dark big letters, do not use left arm for blood pressure. And underneath that, write the word reason, followed by a colon, and that particular reason, such as left-sided mastectomy, lymphodectomy, AV fistula used for dialysis, etc. To include with this, draw a stick figure with a large red X placed over the left arm, followed by a drawing of an arrow pointing from the do not use left arm to the red X. This can be helpful information to a new care aide or an added family member just starting out in assisting to care for your loved one. Usually a small booklet will come with the blood pressure machine, but if your loved one did not keep the booklet, look for the blood pressure machine's company name on it, and then look on the internet for a possible company contact phone number for instructions on how to clean the machine properly using the correct antiseptic wipe. Once known, a recommendation may be to wipe the machine and the inside and outside of the blood pressure cuff before and after each use. Prior to taking your loved one's blood pressure, such as in the morning, a recommendation is to have your loved one first use the restroom, for a full bladder can give you a higher reading. As a reminder, no caffeinated drinks should be taken by your loved one prior to taking their blood pressure. If your loved one is wearing any clothes covering the arm, you want to first remove that aside, and before placing the blood pressure cuff on your loved one's upper arm, check the arm first. If your loved one wears a Nicoderm patch to assist with stop smoking, a Duragesic patch for pain control, or a glucose monitoring device for diabetes, you would not want to place a blood pressure cuff over that and may have to use the other arm if allowed. A recommendation is that the next time those need to be changed is to place them toward the upper part of the shoulder above where the blood pressure cuff would go. When ready, have your loved one sit straight up in a chair, legs not crossed, with feet touching the ground. If possible, place your loved one in front of a table, for you want the arm with the palm side up at the level of their heart. If the table is not high enough, a pillow or pillow under their arm until it is, or if a table is not available, try a pillow or pillows placed on their thigh with the arm resting on it. A reason a blood pressure is not normally recommended to be taken with the arm straight down at their side is for it can give a higher reading. Please review with your loved one's primary doctor. Start with the blood pressure tubing situated with it pointing downward towards the palm of the hand. The bottom of the cuff should be 2 horizontal finger lengths above the bend of the elbow, and you should be able to place 2 fingers underneath the cuff to make sure it's not too tight. Most blood pressure cuffs have a directional arrow, and if seen on the cuff, it would be positioned pointing downward or possibly upward if so indicated, but placed slightly over from center towards the side of the thumb where the brachial artery is located. Once you believe you have everything situated and your loved one relaxed, have them take a deep breath in, and upon them blowing out, press the start button on the blood pressure machine. Try not to have them talk during the reading, and once done, record the results, which would entail the date, the time, and the arm that was used in a daily journal. Upon removing the blood pressure cuff, a recommendation is to check their arm, clean the blood pressure cuff and machine with the proper antiseptic wipe, and return the machine back to where it's kept in the home. If you feel you got a misreading, deflate the cuff, wait 10 minutes, and try again. Please review with your loved one's primary doctor. A blood pressure can also be taken on the forearm if you feel your loved one's upper arm is too big or to place a blood pressure cuff over it. For a small cuff over a large upper arm can give a higher reading. The opposite being if your loved one's upper arm is too small, a large blood pressure cuff over it can give a lower reading. Taking a blood pressure reading on the forearm is similar to taking one on the upper arm, with the tubing still angled towards the palm of the hand and the directional arrow pointing downward or upward as indicated, slightly over from center close to the side of the thumb. Placement of the cuff is positioned between the wrist and the lower bend of the elbow. A suggestion is that if you go with your loved one to see their primary doctor, bring your loved one's blood pressure machine with you and review with them proper methods to taking a blood pressure reading on both the upper arm and forearm, with the doctor making any observational changes as needed. On the day your loved one is to see their primary doctor, try to have your loved one avoiding drinking any caffeinated beverages up to 3 hours prior. If it is to be a morning visit, find out if the primary doctor wants your loved one to take their scheduled AM heart and blood pressure lowering medication, or wait till seen by the doctor so as to obtain a possible truer reading. In addition to bringing their blood pressure machine, bring your loved one's daily heart rate and blood pressure journal to show their primary doctor what readings have been recorded on a routine daily basis as compared to the single one to be done in their office. Upon arriving at the primary doctor's office and after determining first if a urine sample will be needed or not, have your loved one then try to use the restroom prior to a blood pressure reading being taken, for again, a full bladder can give a higher reading. Once in the area to be seen by the doctor, make sure your loved one is sitting up straight, preferably in a chair, legs not crossed and feet touching the ground, with a place to raise their arm at heart level to take their blood pressure. If your loved one seems anxious, ask the medical staff person who is to take their heart and blood pressure reading to come back in a few minutes once your loved one is relaxed. Lastly, write any questions down on a sheet of paper prior to seeing your loved one's primary doctor and bring that with you so you don't forget what you want to ask of them. Finally, I want to take this opportunity to thank you for watching today's presentation, and I apologize for the abundance of material covered. Basically, these are just generalized ideas on how to put together a detailed medication list for your loved one and help manage in a home environment. Again, thank you for watching, and may you find this of use for you and your loved ones.